Hi, this is Dr. Fox. Let's talk about the lacrimal system. In this video, we'll discuss the components of the lacrimal system. We'll diagram the route of lacrimal fluid from the gland to the nasal cavity, and we'll distinguish between somatic and autonomic innervation of the gland. So let's start with the story of tears. So the lacrimal gland sits just adjacent to the lacrimal fossa of the frontal bone in the superolateral aspect of the orbit. This is an exocrine gland, so it secretes the lacrimal fluid through ducts onto the surface of the conjunctiva. So once on the surface of the conjunctiva, those tears are in the conjunctival sac, and they are being washed toward the medial aspect of the eye. As the palpebrary blink, complements of the palpebral part of orbicularis oculi, those tears are moved along to what comes next. In the medial aspect of the lacrimal sac, there's an area known as the lacrimal lake, and that is where the lacrimal fluid begins to secrete. On the palpebrae themselves, there are two little lacrimal puncta. This is where the tears are going to be drained from the lake, and from the puncta they are conducted via canaliculi back to the lacrimal sac. That lacrimal sac is the little squeeze ball over which the lacrimal part of orbicularis oculi lies. So when the muscle contracts, it squeezes the bulb, and then when it relaxes, it creates a vacuum that pulls tears from the lacrimal lake into the puncta through the canaliculi and into the lacrimal sac. Those tears move along the nasolacrimal duct, and they're conducted to the nasal cavity, specifically to the inferior nasal meatus, where those fluids are received. So you may notice that when you're lacrimating or crying, you begin to get a stuffy nose. That's a combination of two events. One, it's a common innervation pathway for the mucosa of your nose. And secondly, you have an overabundance of tears, and those that aren't spilling down your cheeks are moving along this lacrimal system and into your nasal cavity, which is why people sound a little congested or snotty when they're crying. If you want a tip, if you're responsible for making someone cry, don't try to make the situation better by explaining the magnificence and intricacies of the lacrimal system. It just doesn't work, and it's not good empathy. So let's take a look at the innervation of components of this system, most importantly, the lacrimal gland. Let's begin with the somatic innervation because this is the most straightforward. The lacrimal gland is somatically innervated by the lacrimal nerve. The lacrimal nerve is a branch of the ophthalmic division of the trigeminal nerve. Recall there's the ophthalmic division, or V1, the maxillary division, V2, which comes into play for the autonomic innervation of the gland, and the mandibular division, or V3. So one of the branches of V1 is the lacrimal nerve. We see this moving through the superior part of the lacrimal, of the orbit, moving toward the lacrimal gland, which we can see seated there. So this is conducting somatic afferent fibers back from the gland, the conjunctiva, and the skin surrounding the gland. So this nerve isn't responsible for the secretion of lacrimal fluid. What is? Well, let's get to that. Remember the good old times when we were discussing cranial nerve 7, way back when in session 3. So the facial nerve has a number of modalities to it, one of which is providing the preganglionic parasympathetic fibers that are involved in the innervation of the lacrimal gland. These fibers are going to synapse in the pterygopalatine, aka the sphenopalatine ganglion, that's in the pterygopalatine fossa, and then postganglionic fibers are going to hitchhike with branches of V2, namely the zygomatic nerve. And those fibers are then going to distribute themselves either directly to the gland or up to the lacrimal nerve to be distributed to the gland. Whenever there's parasympathetic stimulation, the lacrimal gland secretes lacrimal fluid. On the sympathetic side, the fibers that innervate the gland come from the superior cervical ganglion, much like all of the sympathetics to the head. And sympathetic stimulation is going to inhibit lacrimation by constricting the arteries which serve the gland. So parasympathetically, you're secreting lacrimal fluid. Sympathetically, you're withholding from secreting lacrimal fluid. Let's take a more granular look at this pathway. So there are actually two routes to the facial nerve. There is the muscular route or the motor route and the intermediate route. And it's the intermediate route that's of consequence now. Both the intermediate and the motor routes are going to enter into the internal acoustic meatus of the temporal bone. They're going in with cranial nerve 8, vestibulocochlear, and they're both entering into the osseous canal of the facial nerve, and they come together in a geniculate ganglion just before the genu of the osseous canal. So genu means a bend, so genuflect means to bend the knee. And it's at this point, those fibers of the intermediate root, they pass right through that ganglion. They do not synapse, and they are moving forward as the greater petrosal nerve. There are greater and lesser petrosal nerves. The lesser petrosal nerves are of the glossopharyngeal nerve, cranial nerve 9, whereas the greater petrosal nerve are of the facial nerve, cranial nerve 7. And I always remember that because greater has that long A sound that rhymes with facial. Now, what happens next is really quite impressive. So, that greater petrosal nerve, which consists of preganglionic parasympathetic fibers from the facial nerve, is going to move forward and it's going to exit the temporal bone through a hiatus of the facial canal, which is right about there. And there's a groove along here through which the greater petrosal nerve is going to be conducted, and then it's going to dive deep into this hole, the foramen lacerum. We have the internal carotid artery popping up through that hole to serve the cranial cavity. And so it's important that we mention the internal carotid artery because there's a perivascular plexus of sympathetic fibers there that are coming together with the greater petrosal nerve. So preganglionic parasympathetic fibers of the greater petrosal nerve sympathetic fibers from the perivascular plexus of the internal carotid artery come together and they form the nerve of the pterygoid canal. So that nerve is going to move anteriorly into something known as the pterygoid canal. You can see the opening of that there, the osseous opening. And all of those autonomic fibers are heading toward the pterygopalatine ganglion in the pterygopalatine fossa. And we'll have the preganglionic parasympathetic fibers from facial, from greater petrosal, from the nerve of the pterygoid canal, synapse in this ganglion. The sympathetic fibers move right through without synapsing. They've already synapsed in the sympathetic trunk, in that superior cervical ganglion, more than likely. Postganglionic fibers are going to leave that ganglion and they're going to travel up toward the lacrimal nerve. How they get there is really quite impressive. So let's take a look here. So recall there's V1, V2, that's the maxillary division, and there's V3. So maxillary division or maxillary nerve exits through foramen rotundum from the cranial cavity, and it's moving anteriorly. And there is a branch of V2 known as the zygomatic nerve or the zygomatic branch. And that's heading up toward the orbit. And we have postganglionic parasympathetic fibers which hitchhike on that nerve and head up and distribute to the lacrimal gland. So we have another case of parasympathetic fibers, in this case postganglionic parasympathetic fibers, hitchhiking with a branch of the trigeminal nerve. That leads us to the assessment question, and that is injury to the maxillary nerve or a lesion on the maxillary nerve immediately distal to the foramen rotundum will have what effect on lacrimation? Increased, decreased, or no effect? Well, when we think about this, the postganglionic parasympathetic fibers from the pterygopalatine ganglion jump onto V2 well after it's been conveyed through foramen rotundum. So there may be deficits to the maxillary nerve itself, but the postganglionic parasympathetic fibers, which are hitchhiking, should not be affected by that. So there will be no effect on lacrimation. Thank you so much for your time and attention, and I'll talk to you in the next video.